In this lecture, we're going to look at the posterior abdominal wall. So we'll look at the boundaries of the posterior abdominal wall from the lumbar vertebrae and the iliac crest, and we'll look at the muscles that form the diaphragm, psoas muscles, quadratus lumborum and iliacus. We'll look at the vasculature that's running up and down the posterior abdominal wall, primarily the abdominal aorta and the inferior vena cava. And then we'll look at the nerves that are positioned on the posterior abdominal wall, and specifically the somatic nerves. We're not going to concentrate on the autonomic nerves just yet. We'll look at those towards the end of the course. So the posterior abdominal wall is a muscular region that sits either side of the 5 lumbar vertebrae. It supports the retroperitoneal organs like the kidneys, pancreas and duodenum, but it also contains numerous important neurovascular structures like the abdominal aorta and the IVC, like I've suggested. So let's have a look at the boundaries of the posterior abdominal wall. And here we've just got a schematic that's looking at the skeleton of the posterior abdominal wall. And you can see we've got the lumbar vertebrae here, 5, 4, 3, 2, 1. The 5 lumbar vertebrae that form the posterior abdominal wall. We can see we've got the 12th rib running around in this direction, and we've got the iliac crest, and we've got the pelvic brim around in this direction. So the posterior abdominal wall is really this region which we can see here. We can see it clearly in this posterior view as the posterior abdominal wall really being in this kind of area here. So we can see with some details, we've got the 12th rib and the diaphragm forming the superior boundary, and inferiorly we can find the pelvic brim, which is round about here. Anterolaterally, we've got the anterior and the lateral abdominal wall muscles, which we spoke about at the beginning of the course, and posteriorly we've got those 5 lumbar vertebrae running down in the midline. So this is the region on the skeleton that we're looking at. If we add muscles to this region, then we can still see the lumbar vertebrae. So we've got kind of 1, 2, 3, 4, 5 lumbar vertebrae running down here. We've got our anterolateral abdominal walls here, transverse abdominis we can see, and we can see we've got the diaphragm, which we can point out here, and we can see we've got these muscles filling this space on the posterior abdominal wall, lateral to the vertebral column. What muscles do we have? Well, we're going to explore these in more detail, but we have a series of psoas muscles. These muscles are running down immediately lateral to the vertebral column. We can see them here. We have quadratus lumborum, a kind of quadrilateral shaped muscle that is sitting approximately here. And then we have the iliac muscle, which is filling the iliac fossa of the pelvis. And then we'll look at a special communication between iliac muscle and psoas muscle, which is iliac psoas. So let's explore these muscles in a bit more detail. If we look at psoas first, this muscle originates from the transverse processes of the lumbar vertebrae on either side. It also comes from the lumbar vertebrae's bodies and the intervertebral discs, and it's running down in this direction, both the psoas muscles running down in this direction. Both of them insert into the lesser trochanter on the femur, and they actually insert into the femur, lesser trochanter of the femur, as iliac psoas, where they form a common tendon with iliacus muscle, which we'll see in a moment. But these muscles, psoas muscles running down here, sometimes we can have a smaller, just pick out a little tendon here. This is psoas minor, and the larger, deeper muscle will be psoas major. But these muscles are supplied by L2, L3, L4 lumbar nerves via the lumbar plexus, and they're associated with flexing the thigh in combination with iliacus via the iliac psoas tendon. They help to flex the thigh and help to flex the trunk when you're in a sitting position. If we look at iliacus, then the origin of iliacus is coming from the iliac crest. Here we can see the iliac crest running around here, and iliacus is coming away from that iliac crest, filling the iliac fossa. This muscle combines with psoas, like I've just mentioned, to form iliac psoas and attaches to the lesser trochanter of the femur. The nerve supply again is via the femoral nerve L2, L4 from the lumbar plexus, and the action is really just to flex the thigh. Because of its position on the pelvis and not running up into the vertebra of the posterior abdominal wall, it primarily flexes the thigh, whereas the psoas part of iliac psoas also helps to flex the trunk. So if we now look at quadratus lumborum sits lateral to the psoas muscle, as we can see it lateral to the psoas muscle. We obviously have a pair of these, one on either side. But it does actually extend deep to psoas muscle, attaching to the 12th rib and transverse processes of the lumbar vertebrae. So it's attaching to the lumbar processes, the transverse processes of the lumbar vertebrae, and then extends across in this direction, running between the iliac crest here and the 12th rib running up here. So it fills this space, and that's quadratus lumborum. It's supplied by L1, 2, 3, 4 nerves, and it's important in extending and laterally flexing the vertebral column. So here we can see quadratus lumborum. Spend some time looking at the diaphragm, and in the diaphragm we can see we've got this central tendon. This really is like a trampoline that enables the heart to move up and down as the diaphragm moves up and down with respiration, and we have those apertures within the diaphragm allowing the inferior vena cava, the so-called caval opening. This occurs at T8, the esophagus at the esophageal hiatus at T10, and the aorta via the aortic hiatus at T12. But what we can see is that the posterior aspect of the diaphragm also forms part of this posterior abdominal wall. We can see we have these crura extending, these slips of muscle that extend down onto the vertebrae, onto the lumbar vertebrae, helping to actually form this aortic hiatus. So here these crura are forming part of the musculature on the posterior abdominal wall. And then we have these lumbar parts of the diaphragm that are attaching to some arcuate ligaments that are where the quadratus lumborum muscle attaches to. So here we can see that the diaphragm has a whole number of parts, has the sternal and the costal part, which we're not really worried about because they're more anteriorly attaching to the sternum and attaching to the ribs here into the sternal and the costal part, this portion of the diaphragm. For the posterior abdominal wall, we're more interested in this lumbar part, which we can see originating from these medial and arcuate ligaments that are associated with the quadratus lumborum muscle. So here we can see the lumbar part, and also we can see the crura, the left and the right crura that are running down, as I mentioned previously, to attach to the lumbar vertebrae, and these are helping to form the aortic hiatus. And then, as I mentioned, we have these three important apertures. You can see the details on the screen: the caval opening, the esophageal hiatus, and the aortic hiatus at T8, T10, and T12. So the diaphragm is really important in respiration, obviously, helps to change the volume of the thoracic cavity, important in breathing, but it's also a significant part of the abdomen's posterior abdominal wall.